All right. Thanks so much for being on this podcast. My first question that I have for you is tell the audience, a little bit about yourself and how you started in the work that you do today.
Well, thank you for having me. I really appreciate time to chat. My name is Dr. Aerin Sembhi. I am an internal medicine and integrative medicine doctor. My training took me kind of through a number of fields. So I have always been interested in having my own practice, which is what I do now. I started off my training as a rehab doctor and ended up switching back to internal medicine, and then I did an integrated medicine fellowship. Meanwhile, I had four children, and I got to see both sides of the picture of what it was like to, have children and to go through pregnancy and the recovery from pregnancy, and felt like there was a big gap in care, and especially one that took a holistic approach. Um, I think a lot of women feel that after they have a baby, all of the attention just kind of, switches over to the baby, and they're left to kind of just figure things out on their own. And at the same time, there's a lot of things that can happen during pregnancy and childbirth and postpartum that leave women really struggling with health issues. So that's how I got here. So now I have private practice in Seattle, where I help women both prepare for and recover from pregnancy so they can thrive as a mom and really create a legacy of health for their families.
And how do you do that to that end? How do you sort of do accomplish that goal?
Yeah. So again, I take a very holistic approach. So we look at physical health, how are they recovering physically, whether they're having issues with wounds from C-sections, scar tissue, tears that happened during vaginal delivery, or episiotomies, pain that happens just related to the physical demands of having a child. So we look at the physical body. We look at nutrition. I take a very comprehensive look at nutrition using lab testing to get very personalized, because everyone is biochemically unique, and some people have tendencies to need higher amounts of certain nutrients, and prefer or need less amounts of other nutrients. So take a really personalized approach to nutrition. And I use some other therapies. I go into lifestyle very heavily. So as much as we can, trying to create a lifestyle, to the degree that you can, also with all the demands of motherhood, but using lifestyle as medicine as well. And so in my office, I use some therapies like microcurrent therapy, and manual therapy to help speed and recovery and help, have a full recovery as much as possible.
So tell me a little bit about those therapies because they're so new to me.
Yeah. So the microcurrent therapy is a really interesting therapy. This is something that I learned about at the end of my integrative medicine fellowship. One of the microcurrent therapies I use is called frequency specific microcurrent. And this is a tool that delivers a very, very low amplitude, the same level that's in the body already, of electrical current, and pairs of frequencies. So one frequency addresses targets the tissue, and one frequency targets a condition in the tissue. So, for example, if there is scar tissue in the fascia, right, the connective tissue after having a C-section, you can target that scar tissue and help it soften and heal the scar tissue. That's one example. Or if there is inflammation in a nerve, right? Maybe someone's having neck pain. So, and that's coming from probably a couple of things, but one of the things you can target is inflammation in the nerve, and you can help calm that inflammation down. So it helps a lot with pain, especially.
hmm And
Hmm.
so, during pregnancy, as you know, because I want to look at the mental health aspect of it. In
Yeah,
pregnancy, as you know, a lot of women after they have birth, they suffer from postpartum depression. I don't know if you've heard,
yeah,
but it's
absolutely.
really common. And Is that the only thing that women develop after having birth, or is there more to it?
There's really a spectrum of mental health kind of symptoms or conditions that women can have after having a baby. Part of that's related to nutrition. The demands of pregnancy can be very nutritionally depleting. Part of that is can be related to trauma. Part of that can be related to the hormonal shifts. So it can, stem and the sleep deprivation. I mean, there can be lots of underlying things that can lead to changes in mood. It can be anywhere from feeling the baby blues, which are very common, especially in the first 3 to 5 days after having a baby. Um, and then more severe is postpartum depression or anxiety. Some people get intrusive thoughts. There can be a really wide range of different kind of experiences that women can have, and I think it can also happen at different times. So some might experience it in the first few weeks to months after having a baby. Some women experience post weaning depression or anxiety. So when they stop feeding their baby, they can have a change in their mood or mental health. Um, so there's a lot of different places where it can be missed because, if they went to their 6 week checkup and they were feeling fine, it might not be for weeks or months after that they start having symptoms, and then they might not know where to go. So that's what I'm here for, is to be kind of the a source for women to go even in the extended postpartum period, so years after having a baby.
Mm-hmm. And so, like, how do you sort of help women through that are going through those phases of their life?
Well, it's always taking a very individualized approach, right? So we take time to do a thorough history. We review, again, go deep into nutrition, go deep into lifestyle. We look at support. We look at trauma that may have happened. Um, we take a very comprehensive approach and then tailor it to, try to get to the root cause of what's underlying their symptoms. So sometimes it means medication. Sometimes we can use other therapies. Again, we can use the frequency specific microcurrent therapy as well to help kind of calm the nervous system and support overall health too.
Mm-hmm. Given your sort of experience as a mother having four kiddos, how does that sort of experience influence the work that you do today? Like, how does that sort of create a positive impact, looking back, reflecting?
Yeah, well, again, I think one of it is just going through the experience and you know, kind of having that common experience, shared experience. Even if I haven't experienced everything, that a woman could experience, I understand just how demanding it is being a mom and trying to take into those things into account, right? When we're looking at sleep quality, it's sometimes it's almost like you don't want to talk about it because you feel like there's nothing you can do about it because the baby's waking you up. And at the same time, there might be things that can be done to help improve sleep quality, even in those really challenging times when the baby's waking up at night. So I think that's one part of it. I also have the experience of my extended family. My grandmother, she, as a mom of three young children, my dad was 3 years old at the time, she had her leg amputated. And that so it was really hard on the family, right? And so I've seen both from my experience just how much having health issues impacts your ability to be fully present and be, fully engaged and be the mom you want to be, and also the impact, seeing the repercussions down the line when a mom is really, has challenges, how that impacts the whole family. So that's part of the reason why it's so important to me to help women feel well and thrive during these years, because a mother's health is the kind of the, central to the family. She's got to be healthy, and as much as we can to kind of support women so that they can really thrive during these important years.
Mm-hmm. And is there anything that you'd like to learn in terms of something new, or that you're curious about?
That's a great question. So, something that I am going into more now is like scar tissue and just how impactful scar tissue is on the whole body's healing, how it can impact the nervous system, how it can impact, pain in other parts of the body. So, for example, a lot of women come out of childbirth with scars, whether it's a C-section, 1 in 3 women have a C-section, whether it's vaginal tearing or from tears or episiotomies, even epidurals, can leave a scar. So that's something that has been um, on the top of my mind recently is, just how impactful scar tissue can be in terms of your overall health, and what we can do to reduce that scar tissue and help that heal.
Hmm. Was there any sort of mentor that sort of helped guide you to the work that you do today? Like, for example, like I want to be like this person, or I want to be like do that someday.
That's a great question. I've had so many wonderful people in my life over the years during my like my parents have been hugely impactful in my overall approach. They take a very holistic approach to their health, and that was a strong influence for me. My some of my teachers in college and medical school also were very important and kind of guiding my ways. I had a great mentor in my residency. She was also an integrative medicine doctor. She's here in Seattle as well. Um, she taught me some of the tools that I now use with my patients, and um, yeah, so I think there's just so many wonderful people that I've been blessed to cross paths with that have kind of helped me find this path.
Hmm. And given the sort of the path that led you to where you are today, what advice, tips would you give to those that want to do what you're doing?
Um, I think so. I think is just stay true to what you believe. There's a lot of things pulling you in different directions that can pull you in different directions, and if you really feel strongly about something, stay true to it.
Hmm. All righty. Okie dokie.